Hi guys, so this is finally my update to my complete Placenta Previa videos and the story of how I had Isaiah here 8 weeks early. So it took me a long time to film this video because I had a newborn. Under the circumstances, things got really crazy, and then on top of that, I didn't really think that many people were going to watch the video and look to see what my experience was like. And I'm not really sure why I thought that, since I went onto YouTube to find women who had also experienced complete placenta previa, and on Instagram to find, women that I could connect with and kind of see what I could expect, because I couldn't find anything on YouTube, and what I saw on Google was really scary. So let me tell you, my story might also be pretty scary, but I don't want you to panic. So your experience might look nothing like my experience. You might make it all the way to 38 weeks or 37 weeks or however long your doctor thinks it's safe for you to make it. And you might also experience your placenta moving, and that will be awesome, and I hope that for you. But if it doesn't, your experience might look something like mine, and at least you could be prepared for it. But do not panic, because even though things went really wrong with my pregnancy, I had a really healthy baby, and things turned out fine in the long run. There was lots of bumps in the roads, and things got really rough, but in the end, I mean, have this perfectly healthy baby. Let's just pick up where I left off. So where I left you guys off at was I was 30 weeks pregnant, and I was in the hospital for already 3 weeks. My second hospital stay, and I think my fourth. I've been there for 3 weeks, and it seemed like things were going pretty well. I was pretty stable. I didn't really have any other bleeding besides light spotting on New Year's Day after I was admitted to the hospital on December 26th. So it was like 3 weeks out and hardly anything. So there were 2 high-risk doctors in the hospital. My high-risk doctor was a younger doctor, and he was in charge of high-risk pregnancy. There was also another high-risk doctor there who was older, had been there longer, but was not in charge of the department, and they butted heads. And I'm so glad I had the doctor that I did, and he was able to make the final calls, because I believe that it saved my life and saved my son's life, and just, it was the right decisions. So he also was butting heads with the other doctors that were inside the hospital, just the regular OBGYNs, about what should be done with me. So because I was so stable, some of the doctors wanted to send me home, including the other high-risk doctor. They thought, okay, she's stable, we'll just send her home, and we'll schedule a C-section at like 36 weeks. And my high-risk doctor, he said he had seen some things, and that, even though I was stable in the hospital, that doesn't mean that when I went home in a less controlled environment that I wouldn't start hemorrhaging. So he was concerned that that might happen, because I live in a different town than where my hospital is at, and the hospital that's in my town near my house, even though they could save my life, if I were to have him really early, they can't handle a preemie baby that would be as small as he was, because they don't have a NICU, and so he'd have to be life flighted, and that would really not be a very good outcome for me or the baby, because he wanted to keep us together. So let me tell you guys, at 31 weeks, shit hit the fan. That is when I was no longer hanging out at the hospital as a precaution, but because I needed to be there. Things got really, really scary and rough for a while. So at 31 weeks, I started having bleeding every other day, and I wasn't no longer having spotting. I was having significant bleeding running down my legs, bleeding soaking the pillow that was between my legs. And then after I would have bleeding, I would have really intense contractions, and I guess they said the blood causes your uterus to become irritated and want to expel it, so therefore I was having those bad contractions. And then on top of that, I went into what I guess they call prodromal labor, so it's like a pre-labor, but it's not actual labor, and it's not Braxton Hicks, and it was really very painful. They had to give me pain medicine to relax my uterus, and they also gave me a muscle relaxer to relax my uterus, because they were afraid that I was having so many contractions that I would have changes to my cervix, or it would actually start labor. If you actually start labor and you have placenta previa, as your cervix opens, your placenta is right on top of it. It will bleed through and you can bleed out. You also cannot deliver your cervix. You can deliver your placenta first because it's your baby's lifeline, and if you do that, then you will lose your baby. So they were very concerned about whether I was going into labor. So they were withholding food and water from me for hours at a time. Like, I literally went like 37 or 38 hours at one point without any food, water, or ice chips, because they were concerned that if they had to deliver me via emergency C-section, I could, aspirate, like suffocate choke on my food or whatever that I ate. So it was really rough dealing with the pain, like the scary emotions about, this baby could come right now and he'd be really premature. What would this mean for him? Will he be able to breathe? Will he be healthy? And then also not sleeping, obviously, under these circumstances, the pain, the worry. It was just a very stressful time for me. So in the midst of all of this, the neonatologist and the NICU doctors, who were really awesome, came in and told me about what I could expect for having a baby at 31 or 32 weeks gestational age, and the outlook actually looked really good. So when I went in at 25 weeks, they gave me like these horrible outcomes that they said that they could be blind, they could have cerebral palsy, all of these really significant challenges. And I had that in my mind still. And at 32 weeks, they said, you can expect that your baby will likely have difficulties breathing and may need oxygen, that your baby will not be able to suck or swallow yet. They will need to be fed through a tube through their nose that will go down to their stomach. And then you'll have to wait for your baby to grow. You can expect that your baby will probably go home around their due date time. And they may have some cognitive disabilities down the road, something you won't be able to tell right away. But overall, the survival rate and everything else is so much better than at 25 weeks. So don't think about that, what we told you before. Look at it now. 32 weeks is a really magical number to hit. By the way, guys, I was so determined to hit those milestones. Back when I was 25 weeks pregnant, it seemed like 36 weeks was just a long time away. And I asked my high-risk doctor, what could I look forward to? And he said, well, 28 weeks for survival and 32 weeks for the chances of disabilities, like, significantly decreasing. So I was determined to make 32 weeks. So at 31 weeks, I was like, I'm going to push forward every single day. Honestly, none of it was under my control. So I say I pushed forward, but I really meant mentally. My body maybe followed suit, but I mean, you really can't control it. That's what I learned with placenta previa. Even if you're on bed rest, even if you're following all the doctor's orders, even if you're in the hospital not getting up, you can still bleed. So proceed with caution, but at the same time, know that it is not anything that you do is really not going to absolutely prevent hemorrhaging from occurring. So I turned 31 weeks on a Thursday. That night, Thursday night to Friday night, I was sleeping. I was staying in the hospital. My mom was not there. She had went home to get some rest. My boyfriend wasn't there because he was working, and I was all alone in the hospital. Mind you, I'd already been there for 3 weeks and everything was looking okay, so everybody was home and I was by myself. So in the early morning hours at like 2 a.m., I wake up and I suddenly feel like wetness, and I had a pillow in between my legs, and that when I looked down, the pillow was like covered in blood, and my pants were like covered in blood. And I immediately hit the call button for the nurse, and I say, I'm not hemorrhaging, but there's a lot of blood, and can you please send somebody in? My nurse comes in immediately, and she like takes off my pants and my underwear, and she says, it looks like a lot of bleed, but to us this is a lot of blood, but to us this is really not very much. So she basically like cleaned me up. She gave me like a pad and everything to put on, and so I in the meanwhile was like texting my family and trying to call my boyfriend and tell them what happened, because I knew that if I didn't let them know, my mom and my boyfriend would be pretty upset that I was keeping this from them, because we don't know what's going to happen. Like, we were told, like, bleeding may start in like start small and then come on heavy, or just suddenly turn on like a faucet. So anything could happen at this point. So I got a hold of them. They came over, and I started having lots of cramping, like contractions, like really bad contractions. Now, after my other light bleeds, I didn't really have contractions like this, but these were like intense contractions where like my brows are furrowed. I don't want to talk to anybody because it hurts so bad. They're registering really high on the monitor, and there's some speculation that I'm going into labor. These contractions last that whole like rest of the morning and to the next day until the next evening. In the meantime, they take me off of food and water. I'm not allowed to have anything, just in case that they have to deliver me. Finally, after they given me some pain medicines, the contractions started to kind of slow down, and I was okay. The next day, I was fine, and then the following day, I had another bleed, and then followed by terrible contractions, pain medicine, and this whole back and forth panic with the doctors. Am I going into labor? Okay, so let's fast forward to I'm 32 weeks, like on the dot pregnant, like 11 o'clock to 12 o'clock. So I'm asleep, and a nurse that I never had before came in and kind of woke me up by whatever it is that she was doing inside the room. She like turned on the light. She started like unplugging things. She was like moving really fast, and I said, like, I don't know if I asked her like what's going on, or if I just gathered that something like was going on, but I know I did ask her like what's happening, and she didn't even really acknowledge me. And then I finally said, is the baby's heart rate down? And she said yes. And at the same moments, this is all happening really fast, within minutes, like this swarm of nurses come into the room. Like seriously, like 8 nurses come into the room. They start prepping me for an emergency C-section. And meanwhile, my mom's still sleeping. She's sleeping on the couch with like at the hospital with me. And I go, Mom, I was like, the baby's heart dropped. And she's like, what? And I was like, the baby's heart dropped. And she's like, oh. And she like gets up, and then then one of the nurses says that his heart dropped for 7 minutes. And so they put the oxygen on my face, and they roll me back to the OR. And at the OR, the doctor ordered them to put the monitor back on me to see where the baby was at right then, like his heart rate. And I guess his heart rate had recovered, or was recovering. So she said, let's just hold off for 15 minutes and like observe, and let's just observe and see if his heart rate goes up. And it did, except for there was like a little 10-second drop. So she said, let's wait for another 20 minutes. Meanwhile, I'm on the operating room table in the bright lights, with oxygen on my face, and nurses swarming around me. Everyone's like prepping their tools, and for 45 minutes just waiting. And then they decided to call it off because his heart rate recovered, and wheel me back to my room. So they said that maybe what happened is that the baby was like holding onto his umbilical cord and made it so that he wasn't getting like oxygen, and therefore his heart rate slowed. And that could happen, and maybe it could happen with normal pregnancies also, but they're not always on monitor, so we have no idea. But the high-risk doctor was concerned that if my placenta was unstable and it was detaching the way that they thought it was, so not only did I have placenta previa, where my placenta was like near my cervix or like overlapping my cervix, but also he thought I had a placenta abruption. So he thought one edge of my placenta was unstable and like tearing off from the uterus wall. And usually with the placental abruption, it continues to tear off from the uterus wall. He thought, so if that happens, if it continues to tear off, and that's the babies where they get their oxygen and their blood, then it can make the baby become in distress. They're not getting everything that they need. And so that was what his concern was. And over that week, that 31, when I'm 31 weeks pregnant, that he started to have drops, and he didn't have drops before. Remember, I was in the hospital for 3 weeks already. And before that, I was in the hospital for another 7 days, and that was not that was not happening. So that was a little bit concerning. So it was like, is a baby okay in there? And it came to the point where everybody was just waiting for an emergency. Like literally, that's what they were telling me. They're waiting for something that's gonna tip them over to the side of delivering me. They're trying to give me as many days possible pregnant and seeing how long I can stay pregnant, because those days really matter for his development. But they're just trying to like, you know, when does the risk like outweigh the reward? So that's basically what they were waiting for. And that, I'm telling you, is psychologically very tough to deal with, because it was just like this waiting game of, am I gonna wake up to like blood soaking the bed? And there were a lot of scary moments where like they had put the catheter in, they let me get up and go to the bathroom, and then just blood, like just blood. So it was just extremely terrifying week. Alright, so my last video got interrupted, so I'm going to pick up from today. This baby has been waking up and off schedule, and so in order to get this video shot, I'm going to talk kind of quietly, because he usually wakes up for when I start talking. Well, any other time he doesn't wake up. As soon as I start talking, he starts moving around. Let's take it to the night that Isaiah was born. So after that terrible 31 week where I was bleeding, passing huge blood clots, just waiting for an emergency to happen, finally at 32 weeks and 2 days, I had Isaiah on January 19th. So how it happened was, I had went 2 days without bleeding, and we thought, oh wow, we're on a upswing, things are going good. And so I believe it was the third day, and it was in the afternoon, and it was kind of interesting how this day went. So they said that because I had went 2 days without bleeding, they finally let me have some food. My sister brought me a deli sandwich, which was like the number one thing that I craved when I was pregnant with him. So I had my last sub sandwich while I was pregnant, and then so I ate that. And then I had not been able to get out of bed for like that whole entire week. So I only had like baths in bed essentially, and I was wearing a catheter for most of the week. Every time they would take the catheter out and let me get up to go to the bathroom, I would start bleeding, and I would end up right back on the catheter. So, which was not a pleasant experience. So they were going to take out my catheter, but my nurse, who I had often, she was like, you know what don't you just see if you get out of bed first with the catheter and see how things go before we take it out, because if we take it out too many times, you might end up with an infection and have to insert it too many times, you might end up with an infection. And she also said that she would help me wash my hair, because while I was in the hospital, I don't know if it was just the environment or what, but my scalp was just like so dry, my skin was so dry, just like flaking off. And she's like, I'll help you wash your hair in bed. And this lady made it happen. She gathered all the supplies, and I don't know, somehow we were able to do it. I had water all running down my back, and she changed out my whole sheets. It was crazy, but we did it. And then she also got me sitting up in a chair. She also was able to get me sitting up in a chair, and I was able to like pluck my eyebrows and like feel good. I was feeling so grimy. Like not being able to take a shower for a week is disgusting. And I couldn't, like I only was able to sponge bathe. So I was just so grateful for that. And we thought, okay, things are going good. And then she left, and the new nurse came in, and I never had her before, and I was really worried about that at this point, because I needed my nurses to be on it, and I was in there as a long-term patient essentially, so they were letting me like pick the nurses that I wanted. And she was a new nurse, and I was like, and my nurse that I had, she said, she's my bestie here, like you can trust her, she's gonna do a good job. And I was like, okay. And so I told her name was Megan. I told Megan, I said, okay, I'm probably gonna break you in. Every time I have a new nurse, something bad happens. And then she's like, okay, I'll be ready for it. And sure enough, she was ready for it. So she gets on, she starts her shift, and I swear no more than an hour into it, probably about 5 o'clock, I start feeling wet, and I look down, and yes, there's blood. And she comes in and she looks, and there's blood, but it was not a big like gush or big like chunk like clotty blood like before. It was like very, very watery, a pinkish red color, and it's just very thin blood. So she says, okay, and she calls in the doctor. The doctor is going to come in half an hour after he gets out of a C-section to kind of assess. The whole time that he is gone, I continue to bleed, and there's some speculation whether or not this is like my water has broken. They pretty much, the nurses think that's not the case, but they're still concerned because this is red pink blood, which means it's active bleeding. Even though I'm not like hemorrhaging, it's not like a lot of blood, it's just continuous flow of blood. So the doctor comes in and he evaluates, and he said, okay, I'm going to come back again in another 45 minutes or an hour or so, and in the meantime, no food, water, or ice, and we're just going to kind of wait and see what happens. So I'm not, he comes back, and at this point I'm like had been having some cramping. I believe like my contractions had started again, and I think as he's about to leave, I feel a big gush. So he had just got done examining me with the speculum, and then I was just about to be covered back up, and I feel this big gush, and I say, I feel like a gush of blood, and they're like, my mom like looks, she like pulls it up before they do, and yes, there's like a lot of blood. And every time I would bleed, these massive bleeds, like I would start trembling, my legs would start shaking, I would get cold because they would like strip me down, but it was like feed into my like, fear, I guess, and I would just like tremble. It was so awful. I was just so worried and so scared about what was going to happen next. And so and I think by this time it's already like 7 o'clock or so, like 7:30. Actually, yeah, about 7:30. And he goes, it's a go. And we're like, what? And he's like, we're gonna take you back. And I said, do I have time to call my boyfriend? My boyfriend had worked and he was at home, and he was planning to come the next day, because every day he was, poor guy, was traveling back and forth to the hospital, and it was just very, very draining. Like, he works in the Bay Area, and if you know about California, the traffic here is just ridiculous. And then the hospital wasn't even in the city where I lived, and it was in the opposite direction of where he worked. So I had been the whole time very concerned about whether or not he was going to be able to make it for Isaiah's birth. And I was also concerned about whether or not I was going to be able to be awake for the procedure, because I was told that if things got, really serious, like I was bleeding a lot, or, the baby's health or mine was in jeopardy, that they would just put me under, like I guess general anesthesia, and just completely be out. So when I got wheeled back the first time, that was their plans. They were just gonna knock me out and just take him when they thought he was in distress. But in this case, I was like bleeding a lot, like just it was starting to gush. But there was like, it was like gush and then slow, and then gush and then slow. So the doctor says that I do have time to call my boyfriend. I call him and he doesn't answer. I had been texting him while they were examining me, and I was trying to downplay the whole situation because I felt really bad, because every single day when I was 31 weeks pregnant, I would have a bleed. It would seem like it was a go. We were going to have the C-section, and my boyfriend would rush over. And I didn't want to do that again to him if this was all gonna like die down. But when the doctor said it was a go and I called him, he didn't answer. I thought, he's not gonna make it. He's gonna miss our son's birth. And I was really concerned about that this whole time, because I really wanted him to be there. It's like both of our first child, and I wanted something to go right. And so the doctor says, call him, and we can't wait for him, but if he like does make it like relatively quickly, we'll let him back into the OR. And I don't think at this point that he's gonna make it. So my mom got a hold of him after they had rolled me back to the OR, and he was already on his way. I guess he was alarmed by the text messages that I was sending to him. He was like reading between the lines of me saying like, oh, I'm bleeding a lot, and that sort of thing. Into the OR, and they actually are able to give me to keep me awake and put the, I don't know what you call it, the spinal tap, do the spinal tap. And this was something I really had wanted. So nothing about how Isaiah was born and my pregnancy went the way that I wanted to. And I was like happy that at least I was going to be able to be awake, even if I was going to be in the operating room alone. But this is like so hard for me to talk about. I'm sorry. So they put me, so I'm like, ready for surgery, and they like begin the procedure. My boyfriend's not there. And I thought that when he was born, when they took him out, they would have like showed me him and said like, he's here, or I would have heard his cry, or I would somehow know that he was there. And I knew that there was a possibility that he would be in such a situation that they would have to like immediately like take him, and I wouldn't be able to see him. But I really thought I would be able to like briefly like, or there would be an announcement of his birth, and there wasn't. And then I got so afraid to ask. I was in there by myself, and I was so afraid. I did not want to know why I couldn't hear him cry and why they hadn't said anything. And so I was just like trying to keep calm, and I was like kind of nauseous, and the anesthesiologist gave me extra oxygen, and I did throw up. And then around the corner my boyfriend comes, and he's all in his like scrubs, and he's smiling, and because he's smiling, I'm like, okay, he's fine, right? The baby's fine, right? And I just ask him, the first thing I say, I didn't know you were here. And he goes, yeah, I was here, been here for a while, but I didn't know you were awake. And I said, they didn't tell me you were here. And I said, is the baby okay? And he's like, yes, the baby's doing good. And I said, what are they doing to him? And they were like, he said, well, they're working on him right now because he's like having a lot of trouble breathing. He's like working really hard to breathe. They have oxygen on him. And I said, I was afraid to ask. So he goes back to be with the baby again, and I start hearing his little cries, and they were so small, the smallest little cries. He was born only 3 pounds and 8 ounces, so that's 3.5 pounds. And the anesthesiologist said, oh, they're gonna bring him this way. They gotta go out that door to get to the NICU. You'll probably see him as he passes by, but he was all covered up inside his little like incubator, and they like take him out in a way. And then I go into recovery, and I'm in recovery for quite a while after the surgery, and I still don't get to see the baby. The neonatologist comes in and like asks me all these questions. Is it okay to give my baby a CPAP because he's having a lot of trouble breathing, so giving him like oxygen, and like some other procedures that they're doing to him. They're asking for my consent, and I'm like half in and half out of it, and I'm like, yes, do whatever you need to do for him. So then they roll me back to they roll me to a postpartum room in another part of the hospital across from labor and delivery. And at this point, it's already like 1 o'clock in the morning. I still have not seen my baby. And they put me into bed, and then at some point in the middle of the night, they bring me a pump, and I'm able to get like little drops of colostrum Still haven't seen my baby. It's probably like, I don't know, 2 in the morning, 3 in the morning or something like that. But I'm also like just in a drugged up haze, just to be honest. And at about 5 o'clock in the morning, a nurse comes in and says, would you like to go see your baby in the NICU? And my boyfriend's like passed out on the couch in my hospital room. And I'm like, yes. And she's like, but if you want to see him, you have to be able to get into the wheelchair. Can you stand up and get into the wheelchair? And I do not give a shit about how much pain I have. I get up and sit in that wheelchair so that I could go see my baby. And so I didn't get to see my baby. He was born at 8 o'clock in the night before on January 19th. I didn't get to see him until like 5:30 in the morning on January 20th. And he's in his little isolette. Well, actually, I kind of lied. I did get to see him. See, I'm telling you, it was such a foggy haze. Before they take me to the postpartum, they roll my whole entire bed into the NICU so that I could see him, but he was kind of at a distance because obviously, like, just how do you maneuver a big hospital bed? And the angle, I can't really see him, so, and plus I'm like all drugged up, so I haven't felt like I haven't seen him at all. So I see him the next morning, and he's like on oxygen. He's like all of these IVs and wires and monitors attached to him, and he's so little, like so little. He has no fat on his bones at all. He's just like incredibly skinny. And I don't get to hold him or anything because he needs to be in there. He's not like, he can't be held just yet. I don't get to hold him until the next day, and eventually I get to hold him. I think it was the January 21st I finally get to hold him. So that's the night that he was born, and I'll probably make another video about like my experiences being like in the NICU for 39 days with Isaiah. Nothing really went how I expected it to go, but at the end of the day, he's healthy. And I don't make this video to complain or sound like, you know, I'm not grateful for having this baby and it's like, oh, everything turned out fine. But you have to realize that this experience was so traumatizing. It was really bad. And I kind of, you know, to make the video not an hour long or longer, I like skipped over a lot of the graphic details and like a lot of it. So that's basically how it went. So what eventually made me have my baby at 30 weeks or 32 weeks and 2 days was I started to hemorrhage. And I'll make another video about like the guilt I felt and my experiences having a baby in the NICU and so premature. Alright, thank you guys for listening. I hope this was helpful. If you have any questions about Placenta Previa or anything else, you can just leave me a message.